scheduled for us. All right, hello and welcome everyone. This is Caleb from TASC at the National Rural Health Resource Center. Today is Thursday, January 6th, 2022. Thank you for taking the time and joining for our VKG today. This is our holiday special. Everyone was so busy with meetings and getting things scheduled, we weren't able to have one last month, so we're doing it this year, and we have a game scheduled for the day. Our objectives today are to network with our peers. So those of you who have your cameras on, thank you and welcome. Good to see your smiling faces. Those of you who don't have them on, if you have the ability, please do turn them on, give us a smile and a wave, say hello to your friends and colleagues. We're going to participate in a shared discussion today about things that make working in rural healthcare special for you, what it means to you and for each of us to work in rural health, why it's important personally, professionally, why it's important to work in rural health, our hopes for the future of rural health, and we'll also provide an opportunity to discuss ways that we find fulfillment in our work, especially times of stress, change, and uncertainty. So last year, if you guys were here, we talked about how different Flex programs throughout the country connect to their employees and engage that community feeling within their office, within the staff. And this year, we thought it would be nice to share and reflect what working in rural health means to us. So in an effort not to just go around and call on each people, Jill and Carl and Misty and Leslie, we thought it would be fun to do it in a neat and fun and exciting way. So we've found a template on the internet and developed the Flex Jeopardy game, which Matt Bancroft from the TASC team has graciously volunteered to be our Alex Trebek for the day. So bear with us. We don't have 3 participants who will battle supremacy. We will have each individual raise your hand as a question gets asked, and that will be your buzzer. Caroline is just sharing the screen here, and she'll discuss some of the rules and the logistics, but we'll all play Jeopardy as a whole group as we go. If we have any questions, we can field those now. Otherwise, I can let Caroline and Matt kind of get us kicked off here.
Yes, thank you, Caleb. Let me explain the rules a little bit of Flex Jeopardy. Number 1, you're going to want to know where your reaction button is. It is at the bottom right of your screen. If you click on that little smiley face with a plus, there is a raise your hand option. What we see on our side is the first person who raised their hand goes automatically to the top. So we will know. So it is timed. Trigger fingers are important here. And then after each question, we will ask you to lower your hand. If we don't, then just remember to lower your hand on your own. You will answer a question. I will read the question out loud, answer in the form of, I will read the answer out loud. You answer in the form of a question, and then you will choose the category for the next question, the category and the amount for the next question. Hope that makes sense. Pretty simple. Some questions will require you to tell us about your Flex program and your unique experiences rather than provide a specific right or wrong answer. We want to hear about your good work. Those are scattered about the board. It may say, in my state, we are doing this to promote EMS, and that'll be an opportunity for you to share that information. Feel free to collaborate with your state teammates in a private chat box, but there is a time limit for responses. Don't forget to say what is, this is Jeopardy after all, what is, who is, how is, answer your question, phrase your response in the form of a question. And with that, let's check this chat box, make sure we don't have anybody. No cash prizes at all. Unfortunately, we probably just would take the cash and not give it out anyway. So with that, Caroline's going to put the options on the board, and I am going to randomly call on, actually, I'm going to count to 3, and the first person to raise their hand can pick the subject and the amount. But the topics are quality improvement, financial improvement, population health, EMS, and innovation models. And Jill, I see that you rose your hand first. Please pick your category and your amount.
Quality improvement for 200, please.
Quality improvement for 200. This program was developed to improve the quality of healthcare provided by CAUSE. Scott Daniels.
What is MBQIP?
What is MB-QUIT? That is correct. Scott, you may pick the category and the amount for the next one.
Let's do financial improvement for 200.
Days and net accounts receivable, gross accounts receivable, and cash on hand are all this. Jill.
Under the finance and operational section of our Flex grant. What is finance and
That is
operational
correct.
section?
Okay, listen, that is correct, but not correct.
Oh, right.
So
What is an FMT's compass?
yeah, go ahead and say the answer, Caroline. What are key financial indicators according to FORHP? All right, Jill, you may pick the next subject.
EMS for 200. Please.
EMS for 200. This program serves as a vital link to emergency health care for rural residents, which is often run by volunteers. Ooh, Michelle Hoffman, close. What do you got your answer, Michelle?
The EMS, the ambulance services?
Okay.
Or what is ambulance services?
I think we're going to give that to you. What is EMS, emergency medical services? Yes, it was pretty on the nose there for that one.
That was a worded weird question.
It was, but hey, and I'll tell you, I came up with some of these and I took them directly from like the Flex Fundamental Guide. So if you have a link to that and you pull that up real quick, you probably word for word would be able to find the answer. Michelle, what's your category and your number?
Let's go quality improvement for 400, please.
Okay.
Michelle, can you lower your hand?
Oh, sorry.
This monthly e-newsletter provides CAUSE with information regarding quality reporting and improvement regarding MB-QUIT. Stephanie.
The MB-QUIT monthly.
Is it MB-QUIT monthly? That is correct. In normal Jeopardy, I would have counted you wrong because you did not phrase it in the form of a question. What is MB-QUIT monthly? Thank you. You may pick the category and the amount.
Population health 200, please.
Can everyone lower their hands, please?
Yeah, make sure you guys are lowering your hands. Okay, population health for 200. The goal of the population health program area is to build capacity of CAUSE to achieve measurable improvements and this in their communities. Jill.
What are the community health needs assessments?
I don't think that one is correct. Dorothy?
What is trust?
That is also not the word we are looking for.
Mr. Olson?
Oh,
What
can I
is
try?
health?
Can I try again? What is cooperation?
Still not the word we are looking for. John?
What is health?
No. At this point, let's go ahead and show the answer. Health
Health
outcomes. That is the official wording again.
I think we should appeal and allow John that. That was very close.
Okay, John, we're gonna allow you that. We'll give it to you. I mean, it's not real Jeopardy, so we can make our own rules, right?
Let's go with innovation models for 200.
Okay, innovation models for 200. This optional program area focuses on developing innovative rural healthcare models that improve quality, finance operations, population health, and/or system delivery in rural communities. Misty,
What is innovative model?
what is innovative models? I'm not for sure. Hold on. You will not be surprised to find out that I do not have the answers right in front of me. I do believe
Innovative
that
model
is correct. I
development.
do believe that is correct, though. Carolyn, can you hit that? Innovative model development. Yes. You didn't say program area 5, but I'm going to give it to you. Okay. Like, all right. What is your category and amount?
Quality improvement 600.
Your hospitals did this to improve MB quit measures this year. Wow, look at all those hands raised real quick. Okay, Jill, why don't you tell us what your hospitals did to improve MB quit measures this year?
They reported. What is our hospitals reported during COVID?
Oh, well, that's a fancy thing that they did that they didn't have to do, right? Stephanie, what about you?
What is participating in an MBQuip quality improvement cohort on antimicrobial stewardship?
That is great. That's a good one. And I do believe Michelle also had her hand up for this one. Michelle, what do you got? What did your state do?
What is our hospitals participated in HQ or HP courses and the CPHQ exam?
That's great.
Very good. Anybody else want to share with this? You do get points for this if you do share. Nick.
EDTC. We got full reporting from our CAS, so super excited about that. So, what is EDTC? I should say.
Yeah,
Thank you.
That's good. That is really awesome. All right, Nick, you went last, so why don't you tell us the category and the number that you would like?
Let's go innovation models for 400, please.
Can you lower your hand, please?
Nick, put your hand
Lower
down.
your hand.
Projects in this program area must include a program planning tool that defines the inputs, outputs, and outcomes of a program. Not for sure who raised their hand first. Clarissa, why don't you go?
What is a logic model?
What is a logic model? Congratulations, that is awesome. You can pick the category and the next.
Question, are any of these double dares or no? Okay.
No.
Let's do EMS for 1,000.
For 1,000.
Oh yeah.
Can you lower your hand, please? Thank you.
EMS for 1,000, not innovation models.
Either works for me. So let's do innovation models for 1,000 since it's on.
Okay, this activity done by another state flex program is innovative. This is a you tell us. So this activity done by a state is innovative. Nick, you raised your hand. What do you got?
Actually, what is mobile integrated health and community paramedicine programs in other states? We are definitely admiring them, and hopefully Alabama will frame our legislative actions to kind of mirror some of those things we can take away from that.
That's awesome. Thank you. Jill?
The Pennsylvania alternative payment model, and I don't know what it's called per se. I know they did get another CMS grant, I believe, but they kind of were leading the way for the chart model.
Pennsylvania Rural Health Model.
Thank you.
Great. Jill, why don't you pick the next topic?
Okay. Financial improvement for 1,000.
Big spenders here. This is a great example of what makes working in rural healthcare special to me. You tell us. This is a good example of what makes working in rural healthcare special to me. Nick.
What is the impact we can make on the populations that have the most critical need in our country? They're the underserved. We have a direct relationship with how it affects them. I think that's pretty awesome.
That is very, very awesome. Caleb, you put your hand up?
I did, but I was right after Jill, so I want to hear what for Jill is special about working in rural health first.
What is supporting hospitals with finance and operation assessments and charge master reviews and things like such that they may not be able to afford to do on their end to help them improve their financial stability?
That's a great.
Thank you, Jill. So what makes working in rural healthcare special to me is the connection back to my almost childhood. From my mom worked in a hospital, so I grew up being in the hospital. So to see how the hospital can become and is part of the community from a different perspective from the one that we have here, from patients visiting multiple different patients in the hospital because their community is so small that they know 5 of the 12 patients who are in the hospital that day, and they go from room to room just being friendly to the different people in the hospital. The community aspect that is present in rural communities as well as the hospital is something that's really, really meaningful to me, and I appreciate that a lot.
And if
Great
I can
answer.
add to that, the hospitals I work with know that I'm a great resource and really appreciate the resources that we do give them.
That's a great example as well. All right, Tori.
I think it's getting to work with all of you and getting to work with really dedicated, passionate individuals who really care about the mission and care about making rural communities a healthier and happier place.
That's a really great one. Kim?
As someone who's worked in a critical access hospital, and now I'm learning the other end on how to keep them running, it's really fascinating. So because I understand the front end of it after having done it. So I just feel very privileged to be a part of learning the financials and how to get them what they need, their needs, the technical assistance. And, you know, now that I've met this group of people, meaning you, to help guide me through that process, it's just, I feel like it's full circle, giving back. And that's just really a great thing. All of us do that.
Yeah, that's a great example. And I have said this many times, and I will say it again, as somebody who grew up on a dirt road in the Delta of Arkansas in the middle of nowhere, yeah, sometimes we are paper pushers or list makers or Excel filler outers and data crunchers and whatever. And you've heard me say this, and I'll say it till my dying day. Even in that, learning the finer points and the nuances of it, the work that we do every day, and this echoes off what Tori just said and what Cam and everybody else said. The work that we do every day with each other in our communities means that someone's going to get better healthcare in their rural community. And I have a little Post-it note that says that on my desk. So in moments of frustration, or I don't feel like doing something or whatever, I'm like, this work helps people get better healthcare. And I no longer live on a dirt road, but I still know people who do, and I want them to have the best access and the best possible rural healthcare. And that's what makes all of this special to me. And that's why I got drug into wearing a jacket today as a Jeopardy host. So there we go. Kim, you went last. Do you want to choose a topic and an amount?
Let's do population health for 400.
Population health for 400, the absence of disparities or avoidable differences among socioeconomic and demographic groups or geographical areas and health status and health outcomes such as disease, disability, or mortality. Somebody tell me who raised their hand first, because I don't think everyone put their hand down.
I don't know if I did. This is Dorothy from New York. What is health equity?
What is health equity is correct. Dorothy, why don't you pick the next category and the amount?
Let me go for population health for 1,000.
Your state shares this example of population health success is. Somebody want to share with us an example of a population health success in your state? Dorothy, go ahead.
Oh, sorry, I raised my hand by accident.
Okay, you don't have to share. That's fine. We're not going to force that. Anybody want to share an example of a success in the population health area of something that you're doing in your state, or maybe you've heard of in another state? Jill?
So we have been continuing to enroll people in health insurance in the rural areas, the exchange and Medicaid, to make sure that everybody has access to health insurance. And we've continued to work with the Be Connected program, which is that connects our rural veterans to access to healthcare and also to prevent suicide.
That's a great effort. Anybody else want to share anything? Please take a second and let us know. I'm just curious as this. Raise your hand if you have used the TASC Population Health Toolkit and the Playing with the Data website on the National Rural Health Resource Center website. Use your reaction to raise your hand or give us some sort of acknowledgement if you have taken the opportunity to use that. I have. Anybody else have? Wow. Okay. Well, either a lot of you are not paying attention or need to make your way over there. I will be placing a link in the chat box, or somebody will be. Definitely use that. That's an amazing toolkit, obviously. And there's a putting the data to use section, which is actually currently being updated right now on the back end. And so we're going to be releasing new scenarios and information. But it's a great way to kind of tune into your community. You can narrow it down to specific equity aspects or population health disparities. And really kind of see what's going on in your neighborhoods and in your backyard. If you've not, I'd literally just play around with it. Like I will be in bed on my phone just messing with it. Like, wow, that's really fascinating. And, you know, interesting things like on the border of like Arkansas, like West Memphis to Memphis, Tennessee, like just the disparities just in those two counties, which are only separated by the Mississippi River. Fascinating stuff. So if you have not had a chance to play around with that, please do so. And like as we said, it is currently being updated and we'll be releasing new things in the future. So be on the lookout for that. Thank you everyone for commenting on how fancy my jacket is. It's not really that fancy, but thanks.
Oh, Matt, I had a quick question. For the
Yes, ma'am.
Population Health Toolkit, does it incorporate any of the 2020 US Census data?
It will. Currently, I don't think it does because it was the census data came between the last update, but we update it annually. So some of the census data will be included on the next push out.
All right, thanks.
Yeah, absolutely.
For everyone's benefit, for North Dakota, our Flex program and State Office of Rural Health support the community health needs assessment process for several critical access hospitals. This year, they're completing 22 critical community health needs assessments. Thank you, Ashley, for putting that in the chat box. And please do feel free to type answers, especially to the narrative-based questions into the chat box. We'd love to hear from everyone. It helps reinforce and helps others hear programs that they might not be familiar with.
Jennifer just put a link also that they have partners that do a similar thing with data, lots of data. Data is important, and health equity, this will be a conversation we have at the RSV this year, a big topic. And so come prepared with that population health data. Just take the time to look at it. I know everyone's busy, but if you get a free second, you'll find yourself kind of getting pulled into that black hole of reading this data. It's easy to use. So, and thank you, Jennifer, for that. All right, who was it? I need a category and a number. We got off on population health because I'm working on that. Who was it? Was it Jill? Jill, I think it was you. Pick a category and a number for us.
Quality improvement for 800.
Quality improvement for 800.
Can everyone lower their hands, please?
That's you, Nick.
Swing beds, RHCs, safe and coordinated care, antibiotic stewardship, and patient experience are all areas of this. Jill.
What is quality improvement under, what is quality improvement? Swing beds is not a MBQIP, but they're all under quality improvement, patient safety.
You are, yes, you are not wrong. Is that the answer we're looking for? Maybe not. Nick, what do you got? You're muted, unless that's on purpose, in which case.
What is core measures? I'm not 100% certain how I need to answer that. I know they're all great progression, but I don't. Yeah, I'm not sure. That's probably not what you're looking for, but they're all really good.
They are measurements, but this is very specific to something that we are doing right now. Jennifer.
QI projects.
Well, with that hint, the quality improvement labs.
That is correct. It's quality improvement projects and quality innovation labs. That is correct. Thank you, Jennifer. Would you like to pick a topic and an amount?
Let's do financial improvement for 400.
A financial document that is filled annually by all CAUs, RHCs, FQHCs, and those receiving reimbursement from Medicare. Misty.
What is the Medicare cost report?
That is correct. What is a hospital cost report as well is another option you could have provided. Thank you. And do you, Misty, want to pick the category and the next number, please?
Financial improvement 600.
One of these is an optional financial improvement category. Obviously a multiple answer. One of these is an optional financial improvement category. Ooh, Scott got it in. Scott, what's your answer?
What are hospital assessments?
That is correct. Individual critical access, hospital specific needs assessment and action planning is optional. So you could have said 2.2, 2.3, 2.4, or 2.5. Scott mentioned 2.2. Scott, you want to pick your category and your amount, please?
Population health 600.
This assessment is necessary to understand the population health needs of a community. Scott, looks like you got in there again.
It's a community health needs assessment.
That is correct. The CHNA is the community health needs assessment. See, we didn't get too difficult on you guys on some of these. On other ones, I realize now that we probably went into too much detail. Scott, what's your category and your amount?
Population health 800.
This TASC toolkit allows you to see various population health data scenarios in your community. Everyone should raise their hand because we literally just talked about it. Jill.
What is the population health toolkit on TASC website?
What is the population health toolkit? That is correct. The link is in your chat. I knew that question was coming up, so I wanted to preemptively get in there with that conversation. Jill, why don't you pick a category and a number?
EMS for 1,000.
Jumping all the way. Well, you're one of those people that jumps around the board, huh? If you were on Jeopardy. This optional activity category relates directly to the second goal of improving the quality of care provided by rural EMS agencies. An extra 100 points if you guess the category number. Leslie.
What is EMS operational improvement 4.3?
That is very close, but incorrect. Jill, did you have your hand up or did you leave it up? Jill?
Yeah, I had my hand up. What is time critical sensitivity?
That is incorrect. Nick?
What is the supplemental EMS funding opportunity?
All of these are like kind of correct.
Okay,
Yes, we
so
don't want
close.
to tell you no, but let's look at the question again. This optional activity category relates directly to the second goal of improving the quality of care provided by rural EMS agencies. John, in Vermont.
What is 4.4 EMS quality improvement?
That is correct. What is activity category 4.4 rural EMS quality improvement? So to everyone else, you were real, Leslie, I mean, I thought you had it until you said 3. And I was like, dang, so close. All right.
That's because we're doing 4.3.
That's the see, there you go. That's awesome. John, do you want to pick your category and your amount?
Yes. Financial improvement for 800.
A hospital in your state has had success in financial improvement by doing this activity. Anybody want to share with us a success of financial improvement at one of your critical access hospitals? Leslie?
I forgot to unraise my hand. I'm sorry.
Okay, you're fine. You don't have to talk unless you want to. John, did you have one?
Yes, one of our CAWs did a comprehensive charge master audit, and to make it consistent across departments in the hospital, as well as comparable to and competitive to their neighbors and peers, and also machine readable. So we were able to support that activity, and they completed, and we're very happy with what they found.
That is very, very cool. Nick, what do you got to share?
One of our calls is actually it has a skilled nursing facility associated with it, and through improving their capture through a swing bed program that significantly helped them throughout COVID because of the surge capacities that they've been dealing with. So financially, it's helped them immensely to work through that, making sure they're optimizing those captures. So that was great.
Awesome. Scott, what do you got?
I'm not going to put it in the form of a question, but several of our CAWs have joined together into a learning action network on revenue cycle. And we look at specific measures in the revenue cycle and on ways to improve it. It also helps us find out some of the areas with some issues with payers that we've been able to confront as a group, all having the same issue with this individual payer. And with that, I'm going to have to jump off because that meeting that we have monthly is about to happen. So,
well, thank you, Scott, for joining us. We appreciate you and always doing good work over there in Hawaii. We will see you next time.
Good to see you, Scott. Thanks.
Take care. Bye.
All right. So who was it that last? Well, John, we'll go for you. John, why don't you go ahead and pick another category in our map?
Let's see, EMS for 400.
Nick, can you put your hand down, please?
EMS for 400. Your state has achieved EMS improvement by doing this. Another open-ended one. Feel free to put your answer in the chat box if you don't want to share out loud or earn any points. Nick, you got your hand up. EMS improvement by doing this.
This year we used our funding for a collaboration with the state EMS office that allowed for the first time all of the state EMS stakeholders to get together and open up a line of communication about what CP would look like for the state. So the first time we got everyone to the table and they all actually were all fired up and excited about the opportunity. So that was really, really great to at least establish that starting reference for it. So good stuff.
That's a great example. I am interested, since we're on sharing in sharing mode, 'tis the season. I'm interested. Does anybody have an example of when they heard of of what another state was doing, and then they implemented that same strategy or tactic in their own state, and how that was successful? I know that's kind of long, but has anyone used another state's idea or approach and had successes with that they would be willing to share? Yeah, past, present, current, maybe even in a dream. Or are you thinking about implementing something? Nope. Okay. Fantastic.
I have to leave. I'll see you next time.
Oh,
Okay?
so Kim not only doesn't have an example, she hates it. Bye, Kim.
I gotta go. I'm sorry. I have another meeting to attend. Thank you.
Looks like Tiffany has her hand raised, and so does Carl. Matt, maybe they have examples.
For our patient experience for the QIL, can you guys hear me?
Yes.
Okay, sorry, just making sure. We actually were able to reach out and get help from Kansas. So we've been having some troubles with like getting the participants, like at the actual hospitals, getting outreach to where they will have patients utilize the swing bed program at their hospital. So we actually got with Kansas and they gave us some great ideas, and we were able to get some promotional stuff and send it out to our cause to where we can get the program more utilized and understood why it's so important, why it's so good to use for the hospitals.
That's a great example. Thanks, Tiffany. Carl, you had your hand up just a second ago. I don't know if that was an accident or if you actually want to share.
No, not an accident. I think what I wanted to say was there are little aspects of lots of different programs that we've implemented and tried to make changes using best practices that are shared through forums such as this, connected with like Shannon Chambers in South Carolina with some community paramedicine ideas. Trying to think of another, Stephen Register, he's on the source side of things, but working with them to get some ideas and bouncing ideas off of each other. So I've seen some new names on the list here just to know from someone who's been here just a little while. to make sure you make those connections and ask each other, bounce ideas off of each other, because it's a good way to build what you're working on and to get ideas for what you can do. So I just wanted to drop that in there, little nugget.
That's a great example and a great encouragement. We have had many conversations here at the center and at the FORHP level about how sometimes it can be discouraging in that pandemic that we don't get opportunities to meet face to face with you guys. And sometimes that disconnects us. And fortunately, we do live in a time where we have Zoom and we do have email and we do have phones and we can pick up and we can chat. And so I will make a shameless plug to make sure that you've updated your state profile. You should have all received emails about that, or will be. That's a great opportunity. That's one of our highest viewed sites or pages on the website. People do look at those. So we would encourage you to update some cool things that you might want to be sharing with other states. And so that's awesome. I noticed that, Jill, you mentioned community paramedicine programs in the chat. Was that just an answer to this EMS question?
Yeah. We've participated in the EMS conferences, and a lot of the community paramedicine talks, and it's been a great resource to get the community paramedicine program going in Arizona, as well as Arizona being able to give back and kind of share what some of the community paramedicine programs that are being developed have done. So it's Nicole has done a great job at TASC to really connect the EMS and community paramedicine programs together to learn.
She is our EMS guru. If you have an EMS question and come to any one of us, we will definitely point you to Nicole Clement. I will take you to her house to answer a question about EMS before I would even know probably how to answer that.
He offered you all to stop at his house yesterday. Now today he's offering you all to stop at my house.
I don't have any more food. I'm leaving for the weekend, so Nicole probably can host you better.
How was the salmon?
It was fantastic, actually. It was really good. I tried a new recipe. It was great. Ashley mentioned that North Dakota, South Dakota, and Arizona are beginning to collaborate together about IHS facilities who convert to cause, and working on connecting all of our hospitals together to learn from one another. That's a great example of collaboration. And Tammy Norville mentioned that, to build on Carl's comment, we are happy to make e-introductions and connections should a need arise. Let us know how we can help. And she has put her email address there. These people that have been here for a while, they know people. It's good to have a mentor, even if they don't know that you're their mentor. Sometimes that word scares people off. So I just talk to people randomly and don't call them my mentor. But it's good to have people in your pocket. And I've been here for almost a year at the center, and I've been able to reach out to many people and just ask them a question. And they've been so generous and kind. So don't be afraid to say, hey, I got a question, or I need more information, or what are you doing? That's going to be incredibly helpful to you. Got a lot of little, Ashley has a secret mentor. Well, that's fancy. I also have lots of mentors that don't know that they're my mentors, but I'll blame them if something goes wrong. Let's go to the next question. Carl, thank you for sharing. I'm going to ask you to pick the next category and the amount.
Let's go quality improvement for 1,000, Matt.
Quality improvement for 1,000. Please share your methods for reflecting on and recharging your passion for rural health care.
That is not a question.
That's not an answer. It's more of a question, but you're correct. It is not. Nick.
Not an answer. What is not an answer?
Go ahead, Nick.
Well, I just I think that the network that we have here plays such a huge driving role in like just a morale, periodic morale boost that we need, or at least I know that I've needed, because there's been many a days where I've, COVID related or otherwise, come in and you're a bit like the Walking Dead. But when you are have the privilege of working with people that are passionate about what they're doing, and they're believe in what they're doing, and they're motivated and positive. That's just that it's like the recharge you need. So yeah, it's
Great
been a
example.
huge help.
Carl, great example, Nick.
So for me, I think it's encouragement of people that we work with. And we're not trying to make this the Alabama show, but one thing that I focused on this year, we had we nominated a hospital administrator for a No SOAR award, the Community Star. And our nomination wasn't chosen, which was fine with us, but we really felt that that person was above and beyond in their role and really loved their community, loved their hospital, loved their employees, supported them fully. And we wanted to make sure that we could recognize them. So we got our state health officer to sign a certificate. We recognized them. We sent them a couple t-shirts for National Rural Health Day. But that's just one example, and that's not to, we're not trying to show off or anything like that, but we want to make sure that the people that we attempt to serve and to help them do things better are recognized for their efforts to help those that they serve. So my goal is to just encourage those that work with me in the office, but also definitely the people that work in the hospitals who see the patients and see everyone in their community and deal with these people face to face every day, whether it be at their hospital or the grocery store, or just see them around town, just to provide some encouragement. And that's what recharges my batteries.
That is awesome. Caleb?
Thanks. Mine's a combination of both Nick and Carl's. It's connecting with those who you help support and who you are helped by. Even an example is this webinar, where it's different than the normal webinars we have, where there's some detailed things related to the Flex program, but it's a connection opportunity where we're laughing and having fun. It's different. I really like that. I like that we're able to do that and have fun, and it's a very different muscle that we're getting to flex here. And for me, on my side, I worked with Matt, I worked with Nicole, I worked with my entire team, or the entire team, to help develop this, and that was really neat, and it means something to us. And questions like this are really helpful to help me reflect, as well as to hear from others how they connect to it and get recharged. So I agree with both what Nick and Carl said.
Yeah, that's awesome. And I wouldn't, don't be ashamed. I mean, if it works in your state, Carl, Nick, if it's the Alabama show, if that's what works, then it needs to be the Alabama show. I cannot consciously say that I am Team Alabama. I live 10 miles from the University of Arkansas, so I'm only Team Alabama when it comes to rural health, and I draw the line at football and sports, but I will allow that comment in the chat box at this time. Nick, if you want to choose your category and your amount, that'd be awesome.
Nick, will you lower your hand, please?
And unmute yourself.
I'm trying to get faster here. Let's go with EMS for 600, please.
This emerging model complements the traditional roles of EMS providers, so they are partners in public health and community healthcare delivery. Misty.
What is community paramedicine?
What is community paramedicine? Great job. If everyone will lower their hands. And Misty, you can choose the next final three topics and amounts.
EMS for 800.
This newly released comprehensive guide provides assistance to rural communities in navigating a change from unsustainable volunteer EMS to more sustainable models. We are looking for the name of the newly released guide. You have received emails and a copy of the link to this. I know you have because I've sent it out. Nicole knows you have because she led the charge.
You probably attended a webinar about it too, so.
What is the name of the guide? you could actually probably go to ruralcenter.org and do a very quick search in the upper right-hand corner and find it.
I know.
Yeah. Well, you're not playing. Dorothy?
Oh, okay.
That the rural EMS sustainability model?
That is not the name of the guide, but that's a great thing to look up when you're talking about moving from unsustainable volunteer EMS to more sustainable models. I will tell you that like 5 of the 6 words in the title are in the question. Daniel.
There might also be a hint in the chat.
I think Nicole actually posted it in the chat.
Come on, I want everyone to go look at it.
Is it the Sustainable Rural EMS Navigating Change Guide?
That is
Daniel wins
correct.
the whole
Thank
thing.
you,
He gets
Daniel.
all
That
the
is
points.
awesome. All right, Daniel, thank you. You can choose the next category and number. There are only 2 left, so the category has to be innovation models for 600 or 800.
600.
Clearly defined quantitative or qualitative indicators that relate to a program's state goals, objectives, and activities. This is a tricky one. Clearly defined quantitative or qualitative indicators that relate to a program's state goals, objectives, and activities. Jill.
What are outcome measures?
That is correct. Outcome measures, not to be confused with outputs, although I did that earlier, like just a few hours ago. So if you do that, it is human. And for the final category and question, it is innovative models for 800. My state has this great innovative model example to share. Who would like to share a great innovative model example? Really can be anything that's innovative, successful or otherwise. Daniel.
So Ohio does market assessments for our cause. It can be really good for them to, one, not have to pay for a market assessment, but also it's a really good way to encourage cause that aren't participating in Flex into participating, because it's something that's really easy for them to wrap their minds around about a benefit that they'll get right up front.
That's a great example. Thanks for sharing, Daniel. Outside of something maybe that's set in stone, and Jill, I'll let you go in just a second, is there an innovative model that you wish was out there that maybe you haven't taken on, that you're just like, man, I really wish we could do this? No matter how bizarre it may come across, and maybe that's because we haven't, whiteboarded it or brainstormed it in a way. Jill, what do you got to share?
So we have a local hospital, Tucson Medical Center, that started a nonprofit called the Southern Arizona Hospital Alliance, which includes 4 of our Southern Arizona critical access hospitals. And they've been supporting them on things like their EHRs, their buying power, things like that. And then Flex has been supporting them with the financial, operational, and swing bed side. So we've been collaborating together for, kind of extending our resources to really support these hospitals in Southern Arizona. And it's really made a big difference to these hospitals. And 2 of the hospitals that are in this network were like inches away from closing, and this alliance really helps support them from closing.
That's a great example. Thank you, Jill. Nick, you got one?
I'll just coattail on the what kind of Jill and the alliance that they have is, I guess conceptually that's similar to Alabama's Rural Quality Network. We use flex funding for activities that are targeted for the needs of our cause. But one of the things we try to do, which I'm not, the reason why I mentioned is I'm not certain if other states are doing this or not, but certainly value added for our program is that we, when we have these resources that are available, we extend the offering to our small hospital, rural hospital network as well, or SHIP hospital network. And a lot of the time it's applicable to them and it helps them level up their care too. And it's just leveraging the existing resources that we do have available. So I think any of that where we can utilize funding opportunities as force multipliers for our state is a step in the right direction. So
that's awesome. And thank you guys for sharing. And just a friendly, random encouragement to everyone out there. All great ideas started as a thought in the back of somebody's head. In the shower, going to sleep at night, on a car ride home. Everything we do started off as an idea. I was talking with Terry earlier this week about some stuff, and he was just, kind of reminded me that all of this that we do and we work for was just an idea at one point. So these innovative models and these innovative approaches to rural healthcare are important. And, someone out there is going to solve it, so to speak. And maybe that person is you or your state. And so with that in mind, we are going to move to Final Jeopardy. And the way we're going to do this, and just because I'm making an executive decision as the host of the show, is we're actually going to have you put your response in the chat box. Okay, so if you're wanting to chat, or wanting to answer this final question, and then you can put how much you want to wager, I guess, out beside it. If you have points, some of you don't, but if you just want to be a gambling person, feel free. And so with that, the final Jeopardy question of the day is, there are this many cars as of October 2021 in the United States. I will give you a few moments to answer that. There are this many critical access hospitals in the United States as of October 2021. Ashley, that is not correct. But you are super close. Carl, 1 billion fake dollars, yes. Lynette, did you have an answer?
$1,354.
Oh, so close. So close. Some people have gotten it correct. The correct answer is 1,353 as of October 21. We do recognize that there are a few hospitals in the process or maybe have completed that process since then. As a reminder that this is the 25th anniversary of the Balanced Budget Act. So 25 years ago, critical access hospitals were created. And since that time, we have gone from none that had that distinction to 1,353, 54 according to Jill, because they just got a new one. But as of October of this last year, it was 1,353. So again, if you don't think that your work or the people before you or after you are making a difference in rural healthcare, I would just write that number down and realize that's how many hospitals are benefiting from the work that we do, and multiply that by how many patients they see. And that's how many people every year that are impacted by the work we do in rural healthcare. There's a polling question on your screen right now, if you would like to take it. I am your host, Matt Bancroft, and I will be passing it back over to Caleb to wrap up this wonderful VKG.
All right, everybody should give Matt a round of applause. Thank you, Matt, for hosting. That was great. And I hope everyone had fun, as well as learned some things, a couple examples of innovative models, what other states are doing, what you could do. And I also hope that we shared some of the things that make working in the industry in healthcare, not just healthcare, but rural healthcare, what that means to each of us and why and how that is special. So if you haven't taken the polling question, please do take a second to do that. Thank you guys all for participating, riding along. If you didn't play the game at the level of everybody else, that's great. We would like to have everybody here and participate. It was a lot of fun, guys. Thank you very much for your support with everything that we do. It's very helpful for us at TASC.
Happy New Year, everyone. Have a fantastic rest of the day and a fantastic rest of the week.
Thanks, guys. Take care.